for joining us this morning.
Morning to you and to your viewers.
What is your response to these reports that the NHI bill will collapse the country's health system?
Well, I'm not sure what basis the DA has made that conclusion. I think it's important for one to bear in mind that currently we're sitting with a private health system where people paying medical scheme premiums that are at 10% per year. Salaries are increasing at 7%. By the year 2030, an average household will be paying about a third of their income towards medical scheme contributions. So the system is not stable. And so to argue that we should not intervene is problematic, because actually by 2030, most households will not be able to afford any medical scheme cover. And on the public sector, we have our own challenges as well. Yeah. So we need to reform the entire sector, both the public and the private, in order to have a system that's sustainable and of good quality.
The problem is not so much that there's intervention, but the detractors are saying that there isn't a clear plan from government in terms of how this is going to be rolled out.
Well, we have a very detailed plan. We published the white paper in 2017, which is an 80-page document that outlines exactly what we're going to be doing. I mean, I read the DA plan, which is, very thin on any detail. So if you had an alternative, you have very little in the way the DA has actually put together any plan relating to that matter. And I would be very surprised as to how they would come up with an idea that the current plan lacks detail.
How's government responding to the concerns that such a huge amount of money will be placed under the responsibility of one minister when we're already having a state capture narrative in the country?
Well, I think it's important to weigh the risks and benefits. The risks are the ones that you mentioned, and the benefits, though, are that South Africans will be able to have access to a range of services at an affordable rate, because you'll have a single purchaser who will be able to establish those rates. Currently, what you have in the country is you have 80-odd medical schemes trying to buy on behalf of 15 million South Africans, and then you have each provincial department purchasing health services. Can you imagine the benefits of bringing that together and having one single purchaser accessing services and goods at a much more affordable rate? So very clearly there are risks, but in the bill we've dealt with those issues about what are the potential risks to any fund. I should say in the medical scheme environment as well, there are problems in the way the trustees of some of the medical schemes have handled the fund. So it's not as if only the minister would have such risks. These risks currently exist in the environment that we're in.
But there's also concern that government has failed dismally in managing the public healthcare system as it is at the moment. How do you then shift to that process where you're also managing funds?
Well, I think the reason why the public health system is in the current situation is largely a structural problem, because remember that what we have is an arrangement where public facilities receive a budget, and despite the number of patients that they treat or the severity of the disease, they continue to receive a single budget which they must use to manage. What we're introducing is a single fund that acts as a purchaser. So it purchases services from public and private facilities, a far more equitable funding system for health facilities. It will also hold facilities accountable. Where people are unhappy with the service they're receiving, they're able to move to another facility and say to the fund, this facility is not delivering a good quality of service. Currently, in the current health system, there is no regulation of the quality of the service, because the Office of Health Standards Compliance hasn't completed that. But once the NHI is in place, all facilities must be assured by the Office of Health Standards Compliance before we actually contract them to deliver services.
Concerns about the possible deterioration of the quality of service provision, are these unfounded?
I think these are largely unfounded, because we actually introduced the Office of Standards Compliance, because currently nobody actually knows what the quality is, not in the private and not in the public, right? Because the Office of Health Standards...
Really?
Yes, there is no office.
We get complaints like on a daily basis, especially in the media.
Well, I mean, you get complaints, but my point is there is no body that is evaluating the quality in the public and the private system as we speak, right? There is no body that's doing that and providing you with reports. So if you said this facility is better than that facility, what would be the basis? Yes, individuals go in and they say this hospital is not clean, or the staff were rude, or they didn't get their medicines. Those are individual complaints. I'm talking at a level of a facility.
Yeah.
The body that does that is the Office of Health Standards Compliance, and it will do so in response to the NHI. So the NHI needs to contract with facilities that have passed the minimum standards in terms of quality. Then we would have that standard. So the argument that the standards would go down, I can't understand, because we've entrenched in the law that those facilities must meet the standard before we contract with them.
So the NHI is about the funding part of the provision of health care.
And the services as well.
How will this impact on the overall experience of a patient, starting from when they walk into a facility until they get well?
So under the NHI, what we're trying to do is make sure that patients have access to greater number of providers than what they currently are. Can you imagine somebody who had to go to a public hospital each month?
Where will those providers come from? Will it be doctors who are currently practicing privately?
Yes, doctors are practicing privately, pharmacies, GP, dentists, physiotherapists, optometrists, etc. You would not need to go to the hospital in order to access those services. The fund will contract with each of those providers. You will indicate which provider you want to go to, and the fund will then reimburse that provider. So there is a system in place so that you can access services at a local level. You don't need to wait in these long queues anymore to access these types of services.
We can't help the long queues, though, especially in a province like Gauteng, where there's an influx of people from both different provinces and also from the region, the SADC region.
Yes, I think the way the health services are structured currently, most of the providers are linked to where medical scheme members are. And that's largely because that's the way they get their income from, right? But under an NHI system, everybody technically can access services. So everyone doesn't have to concentrate in Gauteng. They can then set up shop in Mpumalanga or Limpopo or Northwest. And so many of those people who need to come here for services don't need to do that because they'll have providers there, because there's no need to concentrate in one particular province.
When is it expected to kick in, and how can we mentally, because it's going to require a mental shift from South African citizens in terms of how we interact with public health and people who have been in the private space now needing to shift over?
Well, the NHI process started in 2012, and it has
still
3
at bill
phases.
stage.
Yes. So when the bill gets passed by Parliament, we would have had in place a structure that would then start the purchasing of services. And our intention is to start with a small package of services and expand those services over time. So the intention is not to have a big bang, but to over time incrementally increase the package of services as the funding becomes available, and making sure that everybody understands.
Just for the benefit of our viewers, a sense of time frames. Is it in the next 2 months? Is it in the next year? Is it in the next 2 years? Is it still just a conversation at the moment?
The bill, once the bill is passed, we will then be able to implement many of the interventions. But the proposal in the bill is that by 2026, the national health insurance should be fully implemented.
Dr. Anbhan Pillay, thank you so much for giving us the time this morning,
Thank you.
Talking about the national health insurance. You're watching The Agenda. Let's take a break. We'll be back in a moment.